And in taking care of patients and communicating with fellow nurses or environmental services or physicians, whoever it might be, we have to really focus on the quality of our relationship, and communication has to be excellent.
This is the James Cancer-Free World podcast. I'm Steve Wartenberg, and my guest is Ruth Frankenfield, a James nurse and a psychiatric mental health advanced practice nurse. Ruth is an expert in several areas of nursing and relationship-based care, including the sometimes difficult but important area of assertive communications to resolve conflicts, which is what we're going to talk about today. Welcome to the podcast, Ruth.
Thanks, Steve.
So I'm always curious to find out a little bit about your background, my guest's backgrounds. How did you get into nursing and then all your different specialties along the way?
I went into nursing because I knew when I was 6 years old that I wanted to be a nurse. It took me a period of time to get there because I grew up in the 60s and did the whole 60s radical thing. Grew up from there and then went into, followed my passion.
Why do you
nursing.
think at the age of 6, was there something on TV, a relative that impacted you?
No, I mean, we didn't hardly watch TV. Honestly, Steve, that's a really good question. I knew one person who was a nurse, but her model of nursing was showing me how adept she was at flipping a coin off of a very starchy, tight bed. So, I don't know.
Nursing's come a long way since then.
A long way, right. No, I'm sure that I heard about nurses, working in hospitals and had, an experience here or there with nurses in physician's office and so on. And I was attracted to the healthcare field and helping people, and I don't know. I just knew.
You were a natural caregiver.
I guess so.
Where did you start out? Or what did you start out doing? What type of nursing?
I started out doing med-surg nursing, so caring for a general population of in-hospital patients, and did that for 2 or 3 years, and then moved into labor and delivery and did that for 2 or 3 years. From there, I became a home health nurse, so got the opportunity to work with people in their own homes. And get, a broader view of individuals struggling with, healing from a variety of illnesses in a very personal way. It's much more holistic in the care. And during that time, I'm going to school and, got my master's degree and took a position with the Columbus Health Department. As site director of a program developed to do outreach to individuals at high risk for HIV infection. And this particular population were IV drug users and sexual partners of IV drug users, most of whom were engaged in prostitution. So it was really a program that was nationally funded to see what level of education intervention would really make a difference with people engaged in high-risk behaviors. So, that position, working with that population and the street outreach workers, was a real eye-opener. I think supported a lot of my own emotional intelligence and emotional growth in terms of how do you really connect with effectively people that are very different from you, people that have a different lens on life than you do. How do you reach them, human being to human being? So I think that was very helpful. From there, I moved into the arena of psychiatric mental health. I went to the Gestalt Institute in Cleveland. I had decided I wanted to become a psychotherapist. And there's a 3-year training program at the Institute, and I was trained to be a psychotherapist.
So I've heard that term a lot, psychotherapist, and I know that that's training that many nurses do. So what exactly is a psychotherapist?
Psychotherapist is an individual that helps folks look at struggles that they might be having in their life moving forward sometimes. Sometimes it's anxiety disorder. Sometimes it's depression. Sometimes they're in conflictual situations with partners, with work situations, just a variety of issues that they just can't seem to get through. They're stuck. Sometimes stuck in their careers, their creativity. So, you address a wide variety of issues, but helping them work that through and gain some insight.
Now, is that done in a hospital setting where they're patients for something else, or where they're coming to see you for these life issues?
You don't typically do psychotherapy in hospitals because it's usually fairly intense. It involves a period of time. Patients in hospitals are really there for their medical conditions. So while we do counseling, and, we're able to see a patient, 2 or 3 times for, a half hour or so. It's different from seeing a person in your office. So I had a private practice in Worthington, and I had clients that I saw for an hour at a time over a period of, it could be weeks or months or years.
So good. So that gives me a great understanding of it. And now I guess the next leap, the next jump is how, when you came here to the James, how you took those skills and what you brought here and how you used them to help people.
Mm-hmm. Okay. I think that the experience that I had and the training that I had as a psychotherapist, as a counselor, as well as the experience that I'd had in doing a variety of nursing roles in various settings, including hospice, really created an ideal background for me to understand and connect with patients that are going through, life-changing illnesses, sometimes end-of-life experiences, life-threatening illnesses, and work with the staff, the nurses that are taking care of them, and some of the concerns and struggles that they have in, really being present and feeling as though they're giving the best that they can to every patient, every family member.
Yeah, that's something I'm just starting to really learn about fully, is this concept of staff taking care of one another and having experts like you that help staff with their issues. And in one of our past issues, your colleague Amy Lindsay talked about that and how people can relieve stress, and that you coach and work with them. And so that's just amazing, this whole awareness and growth of this area. And so that's what you do now.
Right.
And then one of the other, so in addition to that, this concept of assertive communication to resolve conflicts, that's another area that you're really an expert in. So fill us in. What is that, and how do you help the medical staff here with that, and how does that lead to better patient care?
Yeah, so I was sitting in my office one day and was approached by one of the staff members who was struggling a little bit with how to resolve a conflict that she was having with another individual, both of whom cared a great deal about themselves, both of whom were very devoted to patient care, but they were just really at odds with one another and, kind of at a stalemate. And she very much wanted to resolve it. And when I began to look into, what are some techniques or models of communication that I could use to help her to navigate this difficult conversation, when I began looking into the literature, learned, of course, that these conflicts that individuals get into, whether it's in a hospital or a business or the government or whatever.
Yeah, there's conflict everywhere.
Oh, my gosh, especially now.
Yeah, I was going to say, it's not any less these days than it was then.
Right. And, where do we get hung up, and how do we begin to resolve that? What are some ways of doing that? And I learned that actually, the American Hospital Association, Joint Commission of Hospital Accreditation, all of these major bodies had begun to really, really pay attention to this because, while it's going on all over the world in every kind of business setting, work setting, family setting, in hospitals, they were able to identify that those kind of conflicts, if it's about conflict, contentious sort of communication diminishes the communication that's so important and necessary for patient care.
Right.
Okay, because people don't communicate fluidly when they're, feeling insecure about the communication, about the other individual, and what do they say and how do they say it, and so on. So that's why it felt very important for me to begin to address this in the context of healthcare with nurse to nurse, nurse to physician, whoever the individuals might be.
So you had to develop on your own, with doing some research, of course, and with your background, you developed some sort of program or some sort of techniques and steps to work on this, I'm assuming.
Well, I didn't develop it. I came across, a model that's now widely used, and it's referred to as D.E.S.C or D.E.S.C, which is an acronym for the four elements of the process. The first being describe, and I could go through it bit by bit, but describe what the situation is, express how the situation or what was said or done impacted you. Specify is the S, specify what you would like to be done differently, what would be helpful going forward. And then the C is for consequence, or as I like to say, why do you care? Why are you making the effort to, bring this up and, talk with the other individual about this? So that's a model. It's elegantly simple in terms of the steps, and that it's a very brief process. That conversation shouldn't take more than, 5 to 10 minutes, That said, it's not easy because nobody likes doing conflict.
Yeah, I guess the hardest part is to get people to come together and go through the steps.
That's right. Right. I don't know, Steve. It's not. People are willing to, really figure out what it is they have to do to get past it. Where, and I've worked with a lot of people on this with this process, and where we get stuck, me included, because I got the same issues as anybody else, is the thing about D.E.S.C is that you have to get to a place where you're willing to let go of proving that you're right.
Yeah, exactly. Right.
You have to be willing to prioritize the relationship. And in taking care of patients and communicating with fellow nurses or environmental services or physicians, whoever it might be, we have to really focus on the quality of our relationship, and communication has to be excellent.
Okay. We're going to take a quick break, and when we come back, we're going to talk a little bit more about D.E.S.C and learn a little bit more about each of those 4 steps.
A revolution in lung cancer treatment is happening at the James. We're proving lung cancer isn't solely defined by location and stage, but rather the individual molecules and genes that drive it. Simply put, there is no routine lung cancer. That's why our world-renowned specialists put their expertise towards treating one particular lung cancer, yours. At the James, we go beyond the routine to prevent, detect, treat, and cure your lung cancer. To learn more, call 1-800-293-5066.
We're back with Ruth Frankenfield, and we're going to talk more about the D.E.S.C way to resolve conflict, which is describe, express, specify, and consequences. But first, Ruth, something that occurred to me in all my conversations with doctors, scientists, nurses, social workers, there seems to be a patient-first mentality that might lead people to be more open to it, to do anything they can to improve patient care, which would lead right to you, wouldn't it?
Absolutely.
So
yeah.
do you find that they're more open?
Yes, almost always. People want to work well together. They want to communicate well together. They want to understand one another so that in working with patients and families, not only are staff communicating well together about exactly what's going on with that patient and family, what needs to happen next, what's going to be most helpful in working with that patient family, but we also all want to work in an environment that's harmonious.
Yeah.
All right, because that's when we're our most creative, and that's when we're happiest, basically, do our best work.
Yeah, and I think you're gonna now go through for us the D.E. and the S.C. and what they mean.
Sure.
And I think that anyone listening, no matter what field they're in, no matter where they work, or even with their family and friends, you can
Absolutely.
use these things because there's a lot of conflicts these days. I mean,
Yep.
some people want to get the vaccination, some people
Yeah.
don't. How do you discuss that with someone?
Sure.
So, yeah, let's go through the describe, express, specify, consequences, a little bit on each one and how that leads to hopefully resolution.
Okay. So starting with the D, or describe, say, for instance, Steve, you and I had known each other a couple years, and we had decided we were going to do this podcast together, and I got here, and, you weren't here.
Okay.
And you didn't let me know, and da-da-da. And
My cell phone died. I couldn't, right?
Yeah, blah, blah, blah. No, but I'm getting impatient.
Yeah.
I'm getting annoyed. And then you get here. I'm absolutely making this up, but you get here and you're like, hi. And I said, well, I've been waiting for 10 minutes, 20 minutes. And you're like, whatever. And, so I'm feeling disrespected. I mean, this isn't like the worst thing in the world that's ever happened to me, but I'm annoyed. And it sets me up to having a unhelpful and unpleasant dynamic with you as an individual. So what I would do with the D is I would, first of all, there's a lot of preparation that goes into, that's a really huge part of doing this process. The first thing I need to do is get myself calmed down, because I need to get myself in an emotional place where I'm neutral. All right. And I need to assume that there is something going on in your world, your life, that precluded you from connecting with me for whatever reason. And I may not agree with it, but from your perspective, I have to give you the benefit of the doubt. I have to be open-minded going into this. All right. So when I get around to the D, the describe, is I'm going to say to you simply the facts of what occurred. So I would say, Steve, I got here right on time with the expectation that you would be here and that we would, move into this at the time we agreed upon. So I described, that's it. It's one sentence.
So the way you just described it, it would be the two people having the conflict who go through this,
Correct.
Who've been trained by you how to do this.
Yes, ideally. Because it takes a lot of training. I mean, it's a simple process, but it takes us so long to get past our being hurt or our being insulted or our feeling as though the other person doesn't care about us. I mean, we make up a lot of stuff in our heads about why this person did this or said this. And, in order to be successful in building a bridge with somebody, reestablishing a healthy relationship, we have to suspend that emotional angst. We have to get to a place where we're able to put it aside and focus on, I want to improve the relationship. That is first and foremost. Not that I'm right, not that I want to punish Steve or prove to him he did wrong to me. That can't be the focus.
Boy, I'm just thinking of all the little conflicts I've had with my wife over the years.
Exactly.
And how if it will not, the unwillingness to listen or say you're sorry or hear the other person's perspective can lead to bigger fights.
It just goes on and on. Yep, and builds.
Okay, so there's the D, the describe.
Yes. And then the express is to make a statement about how that affected me. So I would say, when you didn't show up and didn't express, an apology, a regret about what had happened, I felt disrespected. It's one sentence.
So express your
thoughts. how it affected me.
Yeah.
Right.
Okay.
And important is that in this process is that I use I language. I don't say, Steve, you didn't show up, you didn't care, you didn't respect me, because that will put you on the defense.
Yeah, exactly.
If I'm simply telling you my experience, what I experienced and how it affected me, you're much less likely to get defensive. You're much better able to hear what I have to say because you don't have to defend yourself.
So, I'm a little obsessive about being there on time. So what if at some point where I just really said, I'm so sorry, this happened, this is why I couldn't contact you. When the person acknowledges what you're going through and says they're sorry, do you keep going? Like if I said that right at the beginning, you keep going through the steps then?
Not necessarily.
That could resolve it quickly. But if the person doesn't understand what you're going through and express their side and apologize, then I guess we go to S and specify.
Sure. Yeah, and I think even if you do say that, oh my gosh, I'm so sorry, and I might, depending on what my gut tells me, I might say, yeah, it's, that kind of thing's important to me, and I might also give you some grace and say, but I can also understand, that things happen.
And sometimes it's not one little thing, one thing like being late. It's with relationships, it's little things that build up. And so it might be it's not a one topic discussion. It might be a lot of little things.
Right.
And each side has legitimate points.
Right. But I'll tell you, Steve, what I have learned through my, fairly long life at this point, but also working with people for so many years. And according to the model, if you only, and it's important that you only address the most immediate situation that occurred, not the laundry list of everything that's happened in the last year, because it's overwhelming and you'll just get sucked into it. You get lost like down a rabbit hole. But the example that you're bringing forward right now is a good example of what's important to you, and if you can create a bridge with that particular issue, that's going to be very helpful in the stuff in the past. All right, because it's an agreement between the two individuals that this communication, this respect matters. Okay.
So what are we up to next?
We did the D, we did the E. Yeah, the state, the S, what we want differently next time.
Okay.
Right.
Be on time.
Yeah.
Or let me know.
Precisely.
If you're going to be late, you have my cell number.
Precisely. Yeah. Okay. And you don't need to go on and on about it, and that's one thing that I really like, because people are so scared about doing this, so scared about doing it, because conflict is so hard. 90+% of nurses, and I bet is more generalizable than that, will deal with conflict by avoidance. They just don't want to go there. So to make it really, really simple, just deal with this little situation that occurred. Maybe it's not little, but last situation is very helpful.
And that leads us into consequences.
Yeah, consequence, kind of a funny word, I think. And like I said, I like to use the word care. It's like, why do I care? Why am I making the effort to have this conversation with you, Steve? Because I could just let it go. I could talk myself out of it being a big deal, or just decide that you're a schnook or whatever and let it go. But really, I want us to be able to work well together. I want to be able to approach you and for you to approach me when there's something that I think would be good for us to talk about. And this certainly is the situation in working with staff in hospitals and other healthcare environments, any business environment, is that relationship is so, so important. And you just, want and need to clear the air. So I would say, I really respect you, Steve, and I care about our relationship, and I care about how well we work together. So, I really hope going forward we can do better. And then I would say, does that make sense to you? Or I ask a question like that to just check in with you and get your perspective.
Okay. And one of the things I found, it can be hard for people to just say, I'm sorry, or I was wrong. And once you get over that barrier and do it once or twice, it becomes so much easier.
Yeah. Well, and in fact, Steve, there's going to be situations where the individual you're talking with really just doesn't share your perspective at all.
Right.
And so, what we really want is for people to be able to hear what one another is saying, what their perspective is, and respect that. Not agree with it necessarily, but respect it and say, okay, I understand where you're coming from.
So now you work with a lot of people on teaching them this and helping them resolve conflicts. What are you hearing back from all the people that you work with?
People that I have helped through this process express enormous relief and gratitude, because people that are referred to me by their manager or whomever, by the time they come to me, they've been roiling around with this situation for a long time, and it's been causing them a lot of pain, and they want it to get better. They want a smooth, collegial relationship with this other person. And they're amazed.
Ruth, it seems like the James is very supportive of these kinds of initiatives and these kind of programs to help the staff.
Mm-hmm. We absolutely are. The model of nursing that we use at the James is relationship-based care. And when we talk about relationships, it's, relationships, first of all, with the patient and the family member, relationship with colleagues, relationship to oneself, and relationship to community. So in every one of those four areas, there's been a tremendous investment of time and energy and attention to developing and sustaining healthy relationships. So certainly the communication, how we are with one another, how we communicate, how we work through difficulties in a very complex environment. It is really sought after, and there's a lot of attention being paid to it.
Wow. It just occurred to me that you have a kind of a cool job.
I got the best job. It's really true.
Wow. Well, thank you for sharing what you do, and giving us some steps and tips and a process for all of us to resolve conflict and get along better, which I think is something we need in the world today.
Oh, thank you. Enjoyed it.
This podcast is brought to you by the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute. For more information, check out our website, cancer.osu.edu.